Can you hear me now? Great. I see we've had a couple other people join us. Welcome. We'll get started with the webinar in just a moment. Looks like we have a couple other people who just joined us. Welcome to today's webinar. This is Mara. I'll be the moderator for today, and we'll get started in just a moment. All right, so thanks again for joining us today, everyone. Like I said before, this is Mara. I'll be the moderator for today, and we'll get started with our advocacy training webinar to help prepare for our Lansing Day next week. So really quick, here's our agenda for today. We have a couple quick housekeeping things we want to take care of. Then we'll have our presentation by Alexis. We'll go over our talking points for next week, and then we also have time for questions. So currently all listeners are in listen-only mode. You are muted. So if at any time during the presentations you have questions, please feel free to chat those out, and then we will address them at the end of the webinar. And just for reference, there are no known or perceived conflicts of interest for the presenters, planners, or content reviewers of this track and of this presentation. And the learning objectives today are that by the end of the webinar, you should be able to identify 4 tips for meeting with or lobbying your legislator. So with that, I'm happy to introduce our presenter for today, Alexis Blizman. She has extensive experience in giving legislative and political trainings. She's done this throughout her career. Alexis joined the Ecology Center in May 2011 as our Legislative and Policy Director, and she works to educate the legislature and the administration on a variety of environmental issues and advocates for policies to protect public health and the environment. And with that, I am going to turn it over to Alexis for her presentation.
Hello, I guess it's afternoon now. So we'll get started. Advocacy Training 101, the power of your voice. Actually, let me figure out how to get rid of this. Sorry, I'm having a technical thing for a moment. There it goes. Okay. So first thing I usually ask people, and obviously I can't see anybody's hands today, but think about sort of what has been your level of political engagement to this point. Are you registered to vote? Did you vote in the last election? Do you know who your U.S. Senator, congressional representative is? And most of the people that we run into at the beginning of this program have sort of that level of experience. And then we ask, do you know who your state senator and state house member is? And a lot of people, may have voted in the last election, but don't necessarily know because they don't get really involved at the state level policies. So this Lansing Day will be focusing on state level policies, so you'll get to know your state senator and state rep if you don't know them yet. So why health professionals? Why are we doing this training for you? Why is it so important that you're involved in Lansing Day? Ratings of honesty and ethical standards in professions really have shown us over the years that health professionals, and especially nurses, have the highest sort of trust level with the public. So not only do we want you to be involved by talking to your legislators, but also talking to the public about sort of what policies should exist. And later on in the training, you'll actually do a media training where you can talk to the media and get the message out into the public. So as you can see, nurses are very, very high at 82%, medical doctors at 65%, and then you get all the way down to members of Congress who, when the poll was done in 2017, were at 11%. I believe that has actually dropped now. Since 2005, over 80% of Americans have listed nursing as the most trustworthy profession. All right, so like I said, next week we're going to Lansing. Just a few things about the Michigan Legislature. We have a paid legislature. Not all states do. We also have a full-time legislature. It meets generally Tuesday, Wednesday, and Thursday throughout the year. I know that if you took a look at the calendar, you would say, wait a minute, is that really full-time? But it is. During election years, they tend to meet a little bit less. So throughout sort of most of the summer and actually a lot of the fall during this year, because it is an election year, there'll be a lot of days off. During the off years, they tend to meet a little bit more, but still are off a lot during the summer. But it's still considered a full-time legislature. It does meet throughout the year. I've lived in a couple other states. I was in New Mexico for a few years, and their legislature only met for 2 months out of the year during off years and 3 months during election years. 1 year was for budget and 1 year was for everything else, and they alternated. The legislative session is also a 2-year legislative session. So this session went from the beginning of January 2017 until December of 2018. And so there's that time post-election when the current legislature is still in session, and that's called lame duck. We may, as this goes forward, find that during lame duck, there's a lot of activity around some of the issues that we actually care about. Often it tends to be things that they're trying to drive through before the new legislature comes in. And so it ends up being a pretty active time and sometimes a little scary for the environment these days. Michigan legislature has 110 members in the House. Each serve 2-year terms. Senators, there are 38 members, each serve 4-year terms. We do have term limits. Those were put in place in the 90s. Each House member is allowed to serve a maximum of 3 2-year terms, so 6 years, and each senator is allowed to serve a maximum of 2 4-year terms, so 8 years, and those are lifetime limits. So somebody cannot go back in after a break. Leadership for 2018. It's important to know because these are the people in the majority who decide generally what gets on the floor, and in the minority, they often decide sort of what the push for what the caucus should support as a whole. So in the Senate, we have Arlen Meekoff as the majority leader and Jim Ananick as the minority leader. The Senate and the House are currently controlled by Republicans. In House, we have Tom Leonard as the Speaker and Dan Lowers as the majority floor leader. And then we have Sam Singh as the minority leader. Sam Singh will be terming out this year, so next year we will have a new minority leader. Same for the Senate, same for the House. I think the only one is the Senate minority leader may still be in next year. Of course, they still have to be reelected to those positions. So there are 2 different types of legislation, and the first one is bills, which I'm sure you all know about. We're going to talk a little bit more about how a bill becomes a law. The second is resolutions, which is not something that we often put a lot of effort into and don't get really involved. But What a resolution does is it just essentially expresses the opinion of the legislative body. Governor doesn't sign it. It doesn't actually have any real legal effect. It just is more symbolic, where a bill actually is used to change laws. Bill process. So how does a bill actually become a law? So the first thing that happens is a bill is introduced. And what usually happens is you have your main sponsor, and depending on which party they're in, they will go back into their respective caucus and will try and get as many people as they possibly can to sign on from that caucus. So those would be co-sponsors. If it's a bill that they think could actually be bipartisan, they will do the same thing. They will find a co-sponsor to sort of be the lead in the opposite party, and that person will take that same bill into their caucus and try and get as many co-sponsors as possible. It just looks better if you have a large number of co-sponsors, and certainly looks better if you can claim it's bipartisan. So the bill gets introduced, and then it gets referred to a committee. Each bill has to go through one committee in each chamber before it goes to the floor. There are specific ways that something can be removed from committee, but it's not usually done. So after it's been referred to a committee, committee will take it up. There's usually a hearing one week and then a vote the next week. Sometimes there are multiple hearings depending on how controversial the issue is. And a committee can actually decide to sit on a bill and never hear it at all. It's really important then the chairman of each committee is actually a really important position. It's been really critical to our work on climate and energy. The chairman, when they have been friendly, has helped move our stuff, and when they've been hostile, there have often not been hearings at all. So the bill will get taken up in committee, and after consideration, the committee will vote, and we'll do one of a few things. We'll report the bill without recommendation, report the bill with a recommendation. They can take no action, that's what I said. They can take no action after actually having a hearing as well, or they can vote not to report the bill out of committee at all. So in a committee hearing, you can actually express your opinion of a bill or support or opposition through a couple different ways. So if I don't think there's anything that's actually going to be in a committee next week during our legislative Lansing Day, but if there were, we might ask people if they'd be willing to sign a card. Those cards are available at the back of the committee hearing room. And basically what you do is you go in, you fill out the bill number, whether you oppose or support it, give them your name, your organization if you're representing an organization, address, phone number, email, and you also tell them whether you want to speak on the bill or not. So there is a time for comment from the audience. So if you choose to speak at some point during the hearing, they will call the people who had signed cards and said they wanted to speak and give them each about 2 minutes. If you say you don't want to speak on the bill, then they would just read off your name and organization if you're representing one, and say that you oppose or support. Another way to influence committee hearings is to submit written testimony. We've done that several times in the past where we've had letters that we've submitted or reports that go to a committee. Again, that's without any kind of oral testimony. And then there's also testimony that's prepared by formal witnesses. Those are prearranged not by signing the card, but making arrangements with the committee chair or the minority vice chair. And then you're giving a little bit more time to speak. Sometimes you present slides and get asked questions by the members of the committee. We have done that also with a few of our House fellows in the past. That's not something we're going to be asking you to do next week, but there may be something down the road if you're interested, and we can talk about that if bills get introduced that we want to really push or oppose. So back to the bill process. After a bill comes out of committee, it goes to general orders in the Senate or second reading in the House. Basically, they just read off the number and name of the bill again, and then it moves on to the third reading final vote. And that's when you get the vote where every member of the House or Senate actually relays how they support or oppose the bill. And there's a count that gets posted on a board. We'll see that next week if we go look and watch a little bit of what's going on in the chamber. If a bill passes in one chamber, then it gets sent to the other chamber for a vote. Bills must match exactly. So if any amendments happen along the way, then it has to go back into a conference committee to make sure that they are exactly the same language. And then if both chambers pass it, then it gets enrolled, or they can enroll it, they can concur, and then it goes to the governor. The governor has 14 days to consider what he wants to do. Right now, the governor can sign the bill, which makes it a law, veto the bill, which means it does not become law, but the legislature does have the opportunity then to override with a 2/3 vote, serving in each house, and then the bill would also become a law. So what do you do about this? Can you now know how a bill becomes a law, what the steps are, but how do you get something from, sort of a thought of something you'd like to pass to actually, making it a law? So the first thing you need to do is think about, what kind of a plan do you have? You have to really map it out ahead of time. The first question you ask yourself is, what's your legislative goal? Just as an example, because we'll be talking a little bit in the talking points. So we want to increase energy efficiency standards. So who will be your legislative champion? And often you're going to be able to figure this out either from legislative history meetings you've had in the past, or even other bills that have been close in topic. So figure out who your champions are going to be. You are in better shape if you can find champions on both sides of the aisle. Certainly you want to find champions who are in the majority. If you only find legislative champions who are in the minority, then the chances of your bill actually going through at this point are pretty slim. I actually can give you a great example. A few years ago, we had a bill that was introduced in the House by a Democratic legislator and a bill that was introduced in the Senate by a Republican, and they were the exact same language, the exact same bill. I went to a meeting with the then chair of the House Health Policy Committee, who was a Republican, and wanted to talk to her about the bill. And she said to me, well, if the bill comes over from the Senate, the one that was introduced by the Republican, she would have a hearing. If the bill came just from the Democratic side, she would not hear the bill at all in her committee. So it's really important to have some champion who is in the majority. Cooperation is something that does not always go well. Then there are some issues which you actually manage to build coalitions across the aisle, and we've had some luck with that with some of our energy legislation, and I know there's been some luck with that in some of the lead work as well. So, but obviously, anything you can make bipartisan and find your majority champions first is going to get you a lot farther. So then you have to think about which committee your bill will be heard in, and you generally can have a good idea about that. Most things about energy are going to go to the Energy Policy Committee, and then there's a lot of environmental issues end up being heard in natural resources. A lot of the lead work is done in the appropriations. So you sort of can get a good feel for it. Every now and then you'll have something strange happen where the majority leader or committee chair will transfer a bill over to another committee. Usually that's for political reasons. That actually has happened recently with one of the important environmental bills. And I can get you some information about that, but essentially they moved it to something called Michigan competitiveness in order to make it easier to pass through, and it's a really bad bill. You'll probably see something about it in the next week or so. But usually you have a good idea about what committee you're going to be in. So then you have to think about how many votes do you have already, how many do you need? How many do you need to get it out of committee? How do you need also to get it into the next house? How many do you need on the floor? What kind of support can you build in each caucus? Obviously, the further you can get it, the better off. So, think about your committee votes first. And you want to make sure you're talking to the committee. Again, when you're thinking about your legislative champions, if you can find somebody who actually is on the committee that the bill will be heard in, again, you're in better shape. You're coming from a stronger position. The next question you sort of ask yourself is, how public do you want to be about this bill? Sometimes the good strategy is to be really vocal, have a lot of information out in the public. It's something that we think will attract more supporters and more activism on our side. But you also have to consider what kind of opponents you'll bring out if it's very public. So there have been occasional bills that we wanted to be very quiet about and hope they get through sort of without a lot of public attention. So you want to think about which strategy is going to work best for you. Also think about who your allies, who your opponents are, not just within the legislature, but what organizations. Who's going to come out really publicly in support or against, and what kind of influence do they have? And then finally, will the governor sign your bill? Because obviously if you get it all the way through both houses, you want the governor to sign it so it can become a law. Getting past the 2/3 threshold to override a veto is really difficult. So you really don't want that to be part of the strategic plan. So meeting during the legislative session. First thing I'll tell you is that legislators are exceptionally busy. As I said, they are a full-time legislature, but they meet Tuesday, Wednesday, Thursday throughout the year. There are months that they have off, especially in an election year. They are trying to meet with as many people as possible. You want to try and get on their calendar as early as you possibly can. And things will also come up. So you want to call the scheduler to schedule an appointment. If you can bring a few people with you, that's great. Constituents are the best because they care obviously about the people who live in their district the most, because they are the people who can in fact vote for them. Do not be discouraged if you end up meeting with staff. It happens more often than not. Legislative schedules change all the time. Hearings go late. Sessions get changed a little bit. So often you'll meet it with staff. One thing that's happened because of term limits is legislators are there for 6 years or 8 years of Senate. Staff tend to be there for a very long time. So are lobbyists. The people that really know how Lansing works tend to be the staffers and tend to be the lobbyists. So if you end up meeting with staff, these are the people who may know the legislative history around an issue. They tend to be fairly knowledgeable, and the legislators do depend on what the staff says, and they will pass along the information. So it's okay if you end up meeting with staff, but especially if you're meeting with your legislator, or if there's a specific reason why you think this person will be really interested in your issue, you can always pull a legislator off the floor. And basically what you do for that is you can stand outside the chambers. There's a card you fill out and you hand it to the guard, who will go in and hand it to the legislator, who may come out and talk to you during the session. Most of the time for constituents, the legislator will come out and talk to you. You may have to wait a little while if they're in the middle of some kind of vote or debate, but they will come out. Sometimes with specific issues, they may avoid specific lobbyists, so they may not always come out for me or some of the other people when there's hot environmental issues going on. But for constituents, they generally do. Again, you are the people who can vote for them. So what do you do when you actually meet with the legislator? And this, like I said, goes for staff as well. You always want to be nice to staff. They can be a great friend to you. So first, just a lot of this is really common sense. So show up on time, dress appropriately. You don't need to be wearing a suit, but don't be wearing ripped up jeans and some offensive t-shirt either. So start on a positive note. Also, just about dress, a warning, especially if you've got any meetings in the Capitol building or if you're going to be waiting outside. Layers are really good. That building can get exceptionally hot during both winter and summer. It's like the heat is always on in there. So start off on a positive note. Make a brief presentation. So you don't want to talk forever. Part of this is making sure that you won't get the legislators or staffers to talk. So tell them why you're there and what you want to talk about, and really stick to it. If you can personalize it by telling a story, we always ask, if you're a health professional, I'm here to talk about why I want to improve energy standards because air quality in the neighborhood with the patients that I take care of is really bad, and I see asthma attacks constantly. And so we know that burning of fossil fuels causes all of these different respiratory issues. And so by improving the energy standards and using more renewables, burning less, my patients will be impacted in a positive way. So yeah, just personalize it a little bit. Get your legislator to talk. Not too much, because it's great to have a conversation, but they will also, especially if it's an issue that they really don't want to commit to, will go off on all sorts of weird tangents. So try and always bring them back to what you're actually there to talk about. Always in every meeting include a specific ask. So you don't want to walk out of the meeting and not really thinking, oh great, we had this great conversation, but you don't know where they stand on anything. So you want to make sure that if you're asking them to support something, you say, will you support legislation that will improve this or change this, and try to get an answer. Sometimes they will be really upfront with you, and sometimes they'll be evasive. The people who will be leading the groups next week have a lot of experience at doing this and can tell if, sometimes you'll get an answer that sounds really good, but it actually is sort of coded and, is really not quite what you want. The best example, when we're asking people to support new renewable energy technologies or new standards for renewables, often you'll have a great meeting with somebody who says, yeah, and the market's really going to take care of this, and I absolutely support that. When they turn the conversation toward the market's going to make this happen, that tends to mean they're not actually going to support the increase in any kind of renewable standards. But it often, without that experience, it's often hard to tell that that's actually what they said to you. So like I said, the people coming to a meeting with you next week will be able to decode some of that. A critical thing with legislators, tell the truth. If there's a question that you don't know the answer to, that's okay. Don't make something up. Tell them, I don't know, and I'll get back to you. Always end on a positive note. Always follow up with a thank you. So really just going over this in a little more detail, just preparation, know who you're targeting, know who they are. In your packets next week, we'll have bios for everybody you're meeting with, and you'll know a little bit about where they stand even before you go in. Give them information, including like Dave's phone number in case they want more information. So my card or Mara's card or Becca's cards will all be included in the packets. If you have a business card, you should give it to them too. They keep these, they remember. You'll probably get put on their mailing list, but that's okay because it's good to know what they're doing. Again, get to the point right away, stick to it. Don't take things for granted. That's it. Watch for sort of how they code their answers. Ask for their support. Be clear about what you want them to do or support or oppose. I think the most important here is don't be intimidated by them. A lot of people think, oh my God, I'm going to meet with an elected official. And so I always tell my story of my first experience with a former congressman, Congressman Bonnier, who represented part of Macomb County many years ago. I was I was part of the Young Democrats at the time, and there was a softball game between the 10th district and the 12th district at the time. And I was sitting there waiting, and the congressman walked up in shorts and a t-shirt and said to me, "Hi, where's the keg?" And at that moment, I realized, okay, this is actually a person. And so any intimidation kind of went away pretty quickly. And, you know, as you get to know them, it becomes really easy. They are just people. So don't ever be intimidated. And remember that, you know, they work for you. They work for the public. They're a public servant. And then also, you know, if they disagree with you, it's okay. You know, don't take it personally. They have, you know, their agendas as well. Always be polite. Don't be preachy at them. You want to, you know, get your point across and be assertive about it, but you also need to know when to back off. There are going to be some that disagree with you, but they very much may be an ally next time around. So, you know, never badmouth them. Don't walk out of the meeting saying, "Oh my God, what a jerk he is." Especially when you're in that building, you never know who's standing next to you. So, and any legislator that you are on opposite sides of now could absolutely be an ally the next time around. We're finding that already with some of our energy legislation. Some of the legislators that are absolutely opposed to any kind of energy standards are very much on our side when it comes to things like tariffs for rooftop solar, which they are absolutely against. There's sort of a contingency that has a very libertarian take on energy legislation, and so they want people to be able to do what they want, but they don't want any kind of standards put in place. So, you know, we have different allies depending on which part of the issue. Perseverance, so follow up. So if information is requested, get it back to them quickly. If there are questions in your meetings, come back to your team leader or one of us and say, "This legislator wanted to know this, 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 and this," and we will be sure to follow up with them and get the information they needed. And then back to the staff, cultivate that relationship. Like I said, the staff are there forever, and they can be really critical, especially, you know, in such times when it's really crazy at the legislature, like lame duck. Staffers can be really helpful in getting messages through when it's hard to get to them. And then finally, never doubt that a small group of thoughtful, submitted citizens can change the world. Indeed, it's the only thing that ever has, and that really is true. We've seen it happen so many times. So, you know, you can make a difference. We're going to get into our energy talking points for next week. And what I can say, like, one of the things we're going to talk about is the fact that legislation was passed at the end of 2016. Some of our health fellows over the past few years have been really helpful in keeping some of our allies on these issues, you know, really in line when it comes to votes, and have made a big difference in getting legislation through that 2 years ago we thought was going to be horrible and actually ended up being relatively good. So that's all for the advocacy training. And so I will move on now to the energy talking points. And these are the talking points that we're going to be using next week at Lansing Day. You'll have them written out for you next week, and we'll do some practicing as well. There may be a couple of things that get added, but I didn't want to do it now because there's some legislation that may or may not be introduced, and if it's not, we don't want to talk about it. But they'll be easy. They'll just be like 2 short talking points about solar if we have to add them. So a lot of the talking points come from some of the 101 stuff that we did at the orientation. So burning fossil fuels emits dangerous levels of toxic substances in our air, particulate matter, mercury, sulfur dioxide, arsenic, lead. These are linked to 4 of 5 leading causes of mortality in the U.S. Heart disease, cancer, stroke, chronic respiratory diseases, asthma. This is an important one. Michigan's asthma rate, 10% higher than national average. Michigan ranks 5th in the nation in premature deaths, heart attacks, hospital admissions attributed to coal-fired power plant pollution. We spend more than $1.5 billion per year on healthcare costs related to air quality impacts. Pollution from the 9 oldest coal-fired power plants have been linked to 68,000 cases of asthma attacks, 180 premature deaths each year. You don't have to get in all of that. This is where sort of the personal stories can really come in. You know, if you treat patients and see asthma attacks, you can talk about what it's like where you're treating patients. And then you can talk about burning of fossil fuels contributes to air pollution, which creates some of these respiratory problems. So you don't need to get hit on every single talking point. Try and personalize it a little bit with the facts that you have. So big piece of this is Michigan needs energy policies that focus on moving away from burning coal and other fossil fuels, toxic substances, toward clean, renewable sources of energy that reduce illness and rein in healthcare costs and will save lives. This is what I was talking about 2 years ago at the end of 2016. So really the last day of the last legislative session, the legislature actually passed Public Acts 341 and 342. And I know right now that seems like it may even be a long time ago, but really reminding people that this happened in 2016 is critical. There have already been moves to try to eliminate the standards that were put in place under that law. And we know that anybody who's going to be there next year, or who's likely to be still in office next year, is going to be facing a lot of pressure to repeal this legislation. So we want to talk about how this legislation was passed and what it actually does and how it's beneficial. So Public Act 341 and 342. What do? The critical things are they increase Michigan's renewable energy standard to 15% by 2021. They capped Michigan's energy efficiency standard at 1% per year, but also have put in incentives to increase energy efficiency. Energy efficiency is what the utilities have to achieve. Created a combined goal, just a goal, not a standard, of 35%, a combination of 35% renewables and efficiency by 2025. So those are really the important pieces of what that legislation did. But it's also critical to know that these standards expire in 2021. So not only do we want to make sure we keep them in place, but we also want to make sure that we continue to move us forward. So as I said, there are legislators that are talking about repealing the bills. Keeping these standards in place is vital to improving the health of Michigan residents. We want to continue to move Michigan away from the use of coal and other dirty energy. We want to this is sort of the critical point. We want to maintain the progress we've made and advance energy policies that increase renewable energy and energy efficiency for the future. We still have an opportunity to do better. We're not taking advantage of all of the economically viable energy efficiency. There's a lot more that can still be done. Costs of renewable energy generation keep going down because of the improvements in technology. So increasing our investment in renewables will continue to be more and more cost effective, whereas investment in fossil fuels becomes more expensive and the prices are more volatile. And I will add that in for next week, the volatile statement. So Michigan should always consider the health impacts as a factor in its energy planning, and Michigan is capable of much more. So those are the basic talking points for next week. The question to ask, because I say you always want to get an answer to a question, is do you support maintaining the energy efficiency and renewable energy standards we had passed in 2016? And then do you support advancing or expanding the energy standards beyond 2021? So those would be the two questions. And that's it for the talking points. Like I said, I think next week we may, if a bill gets introduced, have a couple more, but we'll go over that with you next week if it actually happens. And that's it.
All right, thanks, Alexis. Now we're going to have Becca go over our other half of our talking points for next week. So with that, Becca, we'll turn it over to you.
Terrific. Thank you very much. So hopefully you can see the slide there on ending lead poisoning in Michigan. And so we'll have two different topics that we'll be talking to folks about in their offices. And I want to let you know that a number of these items that I'm going to show in a few minutes will be in your packets and in lawmakers' packets as well. And Mara will be sending out information like the talking points for you to look at after the webinar today. Okay. So ending childhood lead poisoning is one of the things that we really want to focus on. It is still critical in Michigan to address. Certainly in the wake of the Flint water crisis, there's been a highlight on lead poisoning in Michigan. But lead exposure actually comes from a number of different sources and is an issue that it goes well beyond Flint. We talked about this a little bit during our orientation. And so I want to give you a little bit of information on sources of exposure and where folks are likely to actually have that source happen. So lead paint is estimated to be about 70%, causing about 70% of lead poisoning. And that's the lead paint chips themselves and lead paint associated dust. And the reason that's such a high percentage is that many, many homes that were built before 1978 contain lead paint hazards within them if they have not been removed or remediated. And you usually get the lead paint chips or dust coming out of places when you have peeling or chipping paint due to water damage or in surfaces where you have a lot of friction like windows and doors. So one of the best ways to remediate those hazards if there's something like a surface that has friction is to remove the window jambs or the windows themselves if they're painted, the doors, the door jambs, etc. Or if you have paint on a wall that has lead in it, sometimes it is best to encapsulate that paint rather than disturb it. So as long as it's not chipping or peeling, oftentimes you mitigate lead exposure by just painting over with a safer latex paint. We always advocate for a no VOC latex paint at the Ecology Center. Another source of exposure that's very common in the United States and in Michigan in particular is contaminated soil. This can come from a number of different historic legacy exposures. One would be deposits that have come along roadways and highways from leaded gasoline that wasn't entirely phased out until 1996 in autos, but this phase out started around 1973. And then also in exterior paints or other paint on homes or on properties. So around an old garage, for example, or the siding may have been painted rather than aluminum or vinyl in the past. And again, you get the chipping and the peeling paint that can lead to contamination in soil. Another thing that has recently been getting more and more attention, particularly in cities like Detroit, is actually deposition of lead from demolition. And this is certainly a problem, and one of the suspected issues and why we saw a little bit of an uptick in 2016, which I'll get to momentarily in terms of children testing with high lead levels in certain areas like in Detroit and certain zip codes. Water, folks are probably fairly familiar with the Flint water crisis and water coming from lead service lines and contaminating people's homes and water systems and bodies themselves. There are still a number of different, or many different cities have lead pipes still obviously in the homes themselves, but in the service lines. There's a process that has just gone through its public comment period to improve the lead and copper rule. And the lead and copper rule is the rule that tells us how much lead is allowed. Certainly we wouldn't suggest that it's safe, but is allowed in a water system. At the federal level, that's set by the EPA. And that system-wide level is 15 parts per billion. In Michigan, the new lead and copper proposed rule lowers that to 10 parts per billion. And also includes a household action level so that if an individual home has high levels, that the homeowners or renters are actually given information on that contamination. So because that lead and copper rule is not in the legislature right now, that's an administrative rule that's going through the various departments. We won't actually be talking so much about the lead and copper rule this year, where we have in previous years. We're going to focus more on a couple of other talking points, which I'll get to soon. The final area, and again, not a focus necessary for our Lansing Day, but for your information, is that there are a number of different other products that have been found to have lead in them, including different food products, alternative medicine, cosmetics, like lead in lipstick, for example, consumer products like toys. Folks might be familiar with a number of different toys that tested positive for lead in 2006, 2007, and then there were subsequent bans on lead in toys in Michigan in 2007, and then nationally in 2008. So those are a number of other sources of exposure there. So lead, we know, is a potent neurotoxicant, and I'll get to some of the health talking points in a moment. But we also know that lead is costing our tax dollars and our state quite a bit of money each year. The Ecology Center has put together 3 different reports over the years on the cost of lead exposure, and then on the flip side of that, remediating lead paint-based hazards. So we'll include this cost exposure report for you and for folks in the lawmakers themselves to look at. But we also have a 1-page fact sheet that has a little bit more information for you all. So using very conservative estimates, we looked at the cost of treating, or the cost of 4 different issues related to lead. One, and the largest piece of the pie here is I don't know if you can see my cursor here, is the reduction in lifetime earnings, which is this huge light green piece of the pie. The other things that we looked at were some of the medical treatments. So these 2 pieces here, the orange and the blue one, are the treatment of lead-related ADHD and actual blood lead treatment, so things like chelation. So those are 2 of the 4 areas. Another one is adult crime and juvenile incarceration related to childhood lead. So the dark green here and this dark orange. And that's another piece there, because lead leads to reduced inhibitions and things like that. There are often links to crimes. We used peer-reviewed journals and literature to come up with these estimates, and we worked with an economist on these. So the total cost in Michigan is over $270 million a year. We were using data from 2014 for this, and we're hoping to redo this study soon to have updated data in the next year or so. Those costs would be higher given the 2016 data that we have now, where more children were found to be lead poisoned than in 2014. And then one other piece here, and again, this will be on your fact sheet that's useful, is the cost to taxpayers. So paying for things like special education, lost income tax, cost to the judicial system, et cetera, is estimated to be over $112 million a year. On the flip side, we compared this to the cost of abating 100,000 of the most at-risk homes in the state to reduce that lead exposure risk by approximately 70%. And we found in that scenario, the cost to abate those homes would be about $600 million. It would pay for itself in just over 3 years. So that's an incredible investment that you're typically not seeing in many different public health investments with a return on investment in just 3 years. So again, folks are probably familiar, again, with the Flint water crisis. This is just a reminder. This is a slide from Dr. Monahana Atisha's study and results. As you can see, before the switch, these are elevated blood lead levels in children less than 5 years old. You can see almost a doubling here in all of Flint. If you look at the high water areas, you see even more than a doubling there, not quite triple the results. So you can see how children were affected. If you look all the way on this side, you see non-Flint, but also connected to the water system there. So you can see how many kids were pre-switch, had elevated blood lead levels versus post-switch. So approximately 70% of our housing stock in Michigan was built before 1978. And this is why so many homes have that lead paint associated contamination in them. A few years ago, we were estimated to be the 5th worst state in the nation for the number of lead-poisoned children, according to the Center for Disease Control. In 2016, which is the most recently available data that we have from the Michigan Department of Health and Human Services, there were at least 5,521 kids that had elevated blood lead levels. Now that number is likely higher since we're only testing about 20% of kids in our state. That's directly related to one of our talking points in the policy side of things, because we believe that we should be having universal testing because we're not identifying all of the kids that are being exposed to lead and have elevated blood lead levels and then are not actually getting the services that they need. So communities across our state have alarmingly high percentages. In 2015, for example, over 10% of 1 and 2-year-olds in Detroit, Morenci, Grand Rapids, Adrian, and Highland Park were found to have elevated blood lead levels. We're going to update that for you all with the 2016 data and give you some information there. We didn't have that ready for the slides today. So this is a map again with 2015 data on elevated blood lead levels. You can see all of those dots are kids that have elevated blood lead levels, and those are the number of children. The little dots are less than 6, and they go up from there. You can see you've got clusters in some of the urban areas, but you also have a lot of rural areas that might have tests or might have a lot of kids with elevated blood lead levels, and a lot of that, again, has to do with the housing stock. Another chart here, and you'll have this information in your packet. I'm not going to go through the details, but these are some of the top 10 counties with the 2015 data with elevated blood lead levels in kids. So, lead is still a huge problem in Michigan. When you're talking with folks in their offices, they may think that we have solved the problem, we've put a lot of money into it. You no longer see, for example, children who are having seizures or necessarily dying from lead, as they may have in the past if you're speaking with older lawmakers or even older pediatricians. But it's still an issue. Again, over 5,000 kids were poisoned in 2016, and that's just those that we actually tested. Again, we're one of the worst states in terms of our ranking for lead-poisoned children, and this is an entirely preventable problem. This is something that we don't always have the ability to completely prevent something. We want our lawmakers to make a commitment to ending lead poisoning in Michigan, and thankfully, many of them have, but there's still quite a bit of work to do. And so reaching out to them next week and through the Lead Education Day that our partners at the Michigan Alliance for Lead Safe Homes hosted a couple weeks ago are important steps. On the health and societal impacts, you can see a 4 to 7 point decrease in IQ for every 10 micrograms per deciliter in blood lead levels. Again, these things lead is linked to a whole host of diseases. We're familiar with some of the neurotoxic effects, for example, but there are other cardiovascular effects like hypertension, long-term effects like increased risks of Parkinson, kidney damage, reproductive issues, etc. Estimates show that about over 20% of ADHD cases are associated with elevated blood lead levels. So we talked a little bit about the economic impacts before on the slide, and we're going to move towards some of the different policy priorities. In 2016, Again, after the Flint water crisis, the Ecology Center and other partners called for Governor Snyder and the legislature to take strong, bold action on addressing lead poisoning. Out of this came a number of different actions. One was the Child Lead Poisoning Elimination Board was created in 2016 to come up with different policy proposals to address all exposures of lead, and come up with a roadmap, which you can see a picture of here, to eliminating child lead exposures. I had the privilege to serve on that commission or that board, and then the subsequent commission that was impaneled last year. The map that you can see, the dot map on the right here, is we took the lead elimination board suggestions and prioritized them for action in a new action plan that was recently released by the Child Lead Exposure Elimination Commission. That commission will be having public hearings soon, and we will let you all know about those over the summer. And you can join us and provide your own comments and feedback on our action plan and what we'll be doing with that. One other thing that the Commission has been able to do, and this is again related to what we'll be talking to lawmakers about, is we have been able to provide some seed funding to over 11 different projects across the state of Michigan that are looking to get towards primary prevention of lead poisoning. So removing lead hazards from homes and communities before a child is lead poisoned. Unfortunately, we're still using kids as lead detectors in our state, and we're not actually finding out if a home or a daycare or some other or community building actually has lead hazards in them that could be remediated and removed so that we're not actually poisoning kids. So finding those hazards first in the other environments that the kids are in. So that leads us to the policy proposals. So one of the top things that we think is very important, and there isn't a bill introduced on this yet in the state, is universal testing for all 1 and 2 year olds. As I had mentioned before, we're testing about 20% of the kids in the state. Right now, testing is required for all kids on Medicaid, but actually we're not even testing all of our kids on Medicaid, so no additional enforcement is needed there. But we believe that all children should be tested. Now that test is a simple blood test with a finger prick test is the first step. A finger is pricked in a well child visit for a 1 and 2 year old, and sort of, or a visit where they're going to get their vaccines, and then you can have that blood test. That's a relatively inexpensive test. If a child tests positive at that stage, they are then given a referral to go on and get a venous test, which is a blood draw that the child would have that can confirm that and would have even more detailed and accurate results. Another thing that we think is really important and gets again to that primary prevention is requiring a lead test at the sale or transfer of property. So whenever you sell or transfer a home, actually requiring a test of that home, a lead inspection risk assessment is what it's called, to find out if there are lead hazards in the home. That way, we would actually be able to start documenting where those lead hazards are. And people would go in with that knowledge when they're moving into a home, either if you're leasing or renting it. Right now, there really isn't the burden of proof isn't on landlords, for example, in point 3, to actually submit documentation that they have made their homes lead safe after a kid has been poisoned within their unit. And we think it's also important to disclose, and this is related to 2, lead risks before renting. Right now in our state, if you go to actually buy a home or rent a home, there is a disclosure that's provided that has 3 different options. This home has lead hazards in it, it does not, or unknown. And almost everyone chooses unknown. There's a disincentive right now for folks to disclose lead hazards. And we think unless that is mandated statewide, that we're still going to have this lack of information for folks to know if a home has lead in it or not. So the 4th point here is just for just letting the lawmakers that we talk with know about the Child-Led Exposure Elimination Commission, that we have this action plan and policy priorities. These 3 points beforehand are our policy priorities from the CLEC, that we are aligned with them, and we would encourage all the lawmakers we speak with to communicate with the CLEC members and support the policy and the action plan. We are also asking, and this is the biggest ask of the day, because many of the different 1 and 2 points there's no legislation actually that's been introduced yet. But on 5, we are right in the midst of budget season in Lansing. And there have been budgets that have come out from the governor, and then the Senate and the House have their own budgets. There's a bit of a discrepancy between those different budgets in terms of how much funding would go to the lead abatement program the state runs, and then also the CLEC for those innovative primary prevention projects. So we are asking for the full amount of funding to go through, and we'll have those numbers for you there. That's $1.75 million for abatement for the Michigan Healthy Homes Project at the state, and $1.5 million for the CLEC. And again, as I mentioned, there's some discrepancy. The House is a little bit lower than the Senate and then the governor. And so the governor's request of the budget was the highest at $1.5 million for the CLEC and $1.75 for abatement. And that's what we would ask the House and the Senate members to harmonize with in their conference process. That was maybe a little bit of wonky budget detail, but again, we'll provide that information for you all to make it a bit clearer. Those are all of my talking points, so I think we could open it up for questions.
Great, thanks, Becca. So right now, if folks want to get any other questions that they have in, please do so using the chat box. But one question that we have received from Jessica is there anything else they should do before Lansing Day to be prepared? So memorizing talking points, do more research or homework. What are the tips that you have for them so that they can be prepared?
I'll start. I think that you certainly can look at the talking points. I wouldn't memorize them too much. I would look at them and find out, what are the things that you feel most comfortable speaking about. You all are health professionals, and so quite often some of those health impacts and health implications are going to be the things that are going to resonate, and they're just going to roll right off your tongue. But maybe there's something else. Alexis mentioned personal stories, and that would be the thing that I would encourage you to think about. Have you, in the case of lead, for example, and Alexis can chime in with have you ever had a child come through your practice that's lead poisoned? Or if you're a public health professional, have you worked on lead poisoning issues in the communities where you're working, for example? Or maybe it's your own child or yourself, and you've had asthma, or other folks in your family have had health issues related to dirty air, for example, those sorts of things.
Alexis, do you have anything you'd like to add?
Well, I think Becca pretty much covered it. I would have also said, try and come up with what a personal story would be for you. You want to sound sincere, but it's always good to have thought about it in advance. And just, yes, I would say, look over the talking points again, but don't concentrate on memorizing that. Figure out how you can talk about these issues in a way that resonates with you.
Yeah, and one other thing that I'll add is we will have folders for each of you that will include all of the information that you will be able to take with you to your meetings. So I will say, just from personal experience, even now when I go to meetings, sometimes I'll just read the numbers or the statistics right off of my own paper. And we also will have folders that we'll be leaving with each of the offices, so you can always refer to them that way as well. So it doesn't require you to have every single number memorized.
And then,
all right.
And this was not Oh, sorry, I didn't include this in the presentation, but really important to mention it, and I forgot and should add it into the presentation. Bring your photo ID with you. You cannot get into either of the Senate or House office buildings without a photo ID anymore.
Yeah, great point to make.
So our next question,
and so our next question comes in from Sharon. Becca, this is for you. This is regarding question of item number 5. And will these funds be allocated by county?
Sort of. So some of the funding would be allocated. Let me break it up. So the funding that goes for abatement is used for any child in any county that is tested positive for elevated blood lead levels. Then they can be put into that pool. And so it's not allocated by county, but it's used by kids, by families in counties all across the state. On the side of the CLEAC, the Child Lead Exposure Elimination Commission, we actually in the last year provided funding to the different prosperity regions in Michigan, which does break up the counties into a slightly bigger group, to provide additional funding for them to do education in their different regions. That funding goes to different county health departments within those prosperity regions. And also, there are additional resources and different counties that have expressed the need for an XRF device, which is a device that uses X-ray fluorescence to test for lead hazards. We are purchasing 6 more of those to be distributed through different counties, again, that have expressed that need and ability to use those to look for lead hazards. On the primary prevention side of things, there are different projects as I mentioned, there were 11. They're not equally distributed by county, but we have rural and urban areas and cities and counties that are getting some of those resources. Great question.
All right, so our next question comes in from Rhonda. Becca, this one's also addressed to you. How many new cases of kidney disease or kidney failure have been associated with the onset of the Flint water crisis? And this is pertaining to people without any other association of chronic disease or in areas with high lead.
That's not something that I have any knowledge of. I don't know if that's been studied. We can certainly do a quick search and find out, but I don't know.
Okay, so our next question is pertaining to the Lead Education Day that took place last week. What is the biggest difference between the discussions that were had for Lead Education Day and with the legislation we'll be discussing next week, or is there any?
That's a great question. As you may notice if you were there, the question or the talking points are quite similar. However, we can lobby at our day. So we can actually talk about bills and bill numbers, and we'll provide that bill number information to you and highlight those that are relevant to the top line talking points for the day. And we can actually ask them to fully fund the budget. We can reference the different budgets there and the numbers, which during the Lead Education Day we couldn't, because that was a day that we weren't lobbying at all. So we have a little bit of flexibility in our day where we can actually say bill numbers and we can actually refer to the budget and make a specific budget ask and request. I like that option because it's a little bit more clear. I think the Lead Education Day is terrific, but in a lot of ways we didn't get to have a solid ask. Whereas now we can say, we want you to support this legislation. We want you to support the budget at this amount, and so on. Great question.
Okay, so that's the last question that we had.
Thanks so much for asking your questions. Those were all really helpful. We do have a little bit of time, so I'm just going to ask Becca and Alexis if there's any final things that you want folks to know before next week pertaining to the Lansing Day.
Just have fun with it. Don't be nervous. I think over the last few years, the Health Fellows have actually ended up really enjoying the Lansing Day, even if they were nervous going in. So yeah, just have a good time with it.
Yeah, I would say the same thing. You're going to be in good hands with your team leaders, and we'll have a great day. So I'm looking forward to seeing you all again. I got to see a few of you at Lead Education Day, but seeing the rest of you all next week.
Fantastic. Yeah, and I will say I am also very excited. One quick reminder that I'd like to let everyone know and be aware of is please wear comfortable shoes. Part of Lansing Day requires a lot of walking in between buildings, so wearing comfortable shoes is really a vital piece of that.
Yes, and
So with
dress
that,
for the weather. Who knows what it will be because we're in Michigan.
yes, Lansing always has a tendency to have a couple different seasons in one day. So with that, we are going to turn it over to we have one quick question that just came in from Rhonda. She is asking when the next Lead Education Day will be. Becca, do you by any chance know?
So typically those are once a year, organized by the Michigan Alliance for Lead Safe Homes. It's possible that we may be able to do more in future years. I don't want to promise anything from our end for the fall, but we will keep you posted if another one is organized. There are quite a few different policy education days on the energy and climate side of things, and Mara will always keep you posted on when those occur.
Yeah, that's correct.
Yeah, that's correct. The last one we had was this past fall. It's a little too soon to tell when the next one will be, but there for sure will be one coming up in the future. With that, I am chatting out right now our evaluation for today's webinar. This is required for all Health Leaders Fellows. And this is really so we can get your feedback, learn what it is that you enjoyed about the webinar, learn a little bit more about other topics you'd like to see addressed in future webinars. So it's really helpful for us to get that feedback from all of you. And just a couple quick reminders about next week. So our next event is our Lansing Day, which will take place a week from tomorrow. So Thursday, May 3rd, we'll be meeting in Lansing at the Binskill building, also known as the Senate building. We'll be meeting in room 4900 at 9 a.m. And then we have a full day of meetings scheduled. We are currently confirming meetings with different elected official offices. So one thing is if you have not yet contacted me to confirm your attendance next week, please do so. That way we can split everyone up into teams and have a great day of meetings in Lansing. But with that, we will close out today's webinar. Thanks so much for everyone for joining and having some great questions, and we look forward to seeing you next week. The recording, along with all of the materials that were covered today, will be available later on this afternoon. I'll be sending out an email to all of you, and then you'll be able to check it out on our Health Fellowship webpage as well. So with that, thanks again for joining, and enjoy the rest of your day.